Has anyone noticed something different in the ISO air this past week? No, I'm not talking about the increased pollen count blowing on the wind. When you go on your daily walk, have you noticed that things look a little different? While we've all been locked away working at home in our undies, the buildings that surround us have continued with construction amidst evolving restrictions. Now, even if you haven't noticed it on your walk, you can't avoid it when you see the pictures every couple of days showing the continued work on the Victorian Pride Centre as it nears completion. So what's so special about the construction industry? Well, you'd be amazed what planning and supporting the health of your industry can do, something none of us are going to take for granted when we're on the other side of this current global crisis.
I don't think my predecessor did any media in his entire time as CEO, and there certainly wasn't any COVID testing. I've always really loved construction. I'm a working class boy. So I grew up in Western Australia when it was not fashionable to be a gay man. And I spent a lot of time in and out of the closet as a result. I don't think people really understand now fully what a force for good the construction industry has kind of been.
Eric is the CEO of Incolink, a construction industry body in Victoria that, amongst other things, provides health services to construction workers. And the first thing he did when COVID hit the state was arrange on-site COVID testing by converting a bus used for testing prostate cancer and GP checkups on construction sites into a COVID testing site.
Prostate tests has been a big part of our past. How did we make it work in sort of a large scale really quickly is that we got a bunch of parallel testing done. So we were doing, 4 sites a day without the bus, but actually going into the sites, setting up the lunchrooms with a clinical kind of governance model around it, and then doing hundreds of people through each day with testing. Some places it was just chaotic. I mean, I was out on site and we had places doing 600 tests a day. Certainly it's been one of the most full-on things I've ever been involved in. Anybody else trying to get onto a construction site to do symptomatic testing, any kind of health service, just wouldn't have been able to. But because we have the trust of unions and employers, we were able to do it within 3 days, being asked to do it. To stack out 19,000 tests in 3 months.
That's a massive number and a huge undertaking. And while many of us were trying to decide whether or not to go to a drive-in test site because of a runny nose, they were able to increase the number of tests they were doing even more.
It's been really instructive about how good and how resilient the industry is. The construction industry is really used to working in hazardous environments. There's a lot of stuff written about how adversarial it is, but the industry actually only works because it's a partnership between employers and unions. We had the idea to do it in advance of government. So we thought a good idea would be to do some asymptomatic testing of sites just to make sure they're safe, so that if restrictions got raised, the industry could keep functioning. We've done about 6 times what we'd planned for originally, but it's the benefit of us existing and being able to get onto sites and also workers trusting us. I mean, workers and employers actually trust us. So, they will go and have a swab up their nose, which is an unpleasant experience, but 19,000 of them have. So we found 7 positives out of 19,000 in asymptomatic testing. Those 7 could have easily become 700. Let's be honest about it. But what happened was that the moment you identify someone who's positive, you close down the site, you clean it. Anybody who was a close contact got tested and asked to obey the protocols that have been set up. We had a COVID payment that we pay people to stay at home. They're affected by COVID. So that's something industry set up. We were ahead of the state government in that. And then people could return to work once they were absolutely sure everything was okay.
So you might be wondering why I'm talking about this today. It's because we need to be highlighting the big difference planning and planning early can make for our future. Because of this, Victoria's construction industry is using their time to literally build spaces that will support our future. When we're on the other side of this, of course, and we can all be doing the exact same thing. Over the past month, I've spoken to a lot of people in our communities, some business owners who are having to plan 2 paths, one towards reopening and one towards shutting their doors for good. Some people have resigned from their jobs, while others haven't had a say in the matter and are now working in a different life direction or going back to study. And I've seen communities ramp up accessibility and inclusion in spaces, and I honestly don't see us moving backwards from that. We don't know what tomorrow brings, but there's one thing we can all agree on. Putting our hands over our ears and hoping this passes isn't a pathway that's working. And just because we aren't physically moving around doesn't mean we can't move forward, whether restrictions ease up in 2 weeks or 2 months.
Construction offers a range of wonderful careers that people should really have a look at as well. If you're a young gay man considering your future, consider construction. It's well paid, secure jobs, increasingly safe, and there's a diversity of roles from blue collar to white collar.
Can you believe I made it all the way through to the end of this piece without mentioning the village people or buildings being erected? Maybe I'm maturing in ISO.